Good afternoon, all. I'm Jim McKenna, the CEO and co-founder of Trupath, a learning management system that helps physicians and hospitals achieve great clinical outcomes for patients and great bottom lines for hospitals. So, allow me to tell you a little bit about a day in the life of a hospitalist. So, imagine Dr. Jones receives her list of 15 patients on the first morning of her shift, and the medical director says, Dr. Jones, here's what I'd like you to focus on today. What we need you to do is reduce the infections of all the patients that you're seeing today, reduce their length of stay, reduce their readmissions. If you would increase the case mix index, also what you need to do is document your clinical work appropriately. By the way, you'll have to have a discussion with the Smiths because unfortunately Mr. Smith's cancer has come back. When you finish that dialogue, make sure that they're satisfied. And oh yeah, by the way, try not to get sued. So think about that doctor, overwhelmed. What can I do? Well, this contributes toward patient satisfaction scores are low at hospitals nationwide. So hospitals are actually leaving dollars on the table. In addition, clinical outcomes are not where they're supposed to be. Nationwide, neither is resource utilization. It's far too high. So hospitals are missing out on their full reimbursement. You've all heard of the Affordable Care Act. There's this little thing called value-based purchasing, and within that, some mechanisms for hospitals and physician teams to actually earn back dollars based on success. But doctors have had no formal training about this, either in medical schools or in residency. So the solution for that overwhelmed doctor is to combine the education platforms into one place. Patient satisfaction, so interpersonal skills, operational skills, and financial skills that result from great clinical behaviors. We target hospital-based physicians first. We're growing out from the 30,000 hospitalists nationwide to include emergency medicine physicians, 30,000 intensivists, another 10,000. Beginning there, using a business model, a SaaS business model, to take advantage of monthly subscriptions, anywhere from $20 to $50, depending on how many learning modules that they are taking advantage of. So the multiple revenue streams, again, subscriptions, webinars, and if the hospital is interested, we can gain share. Basically what that means is share on the success in the reimbursement that they receive. So one of the successful case studies that we've had many. We worked with Howard County, one of the Johns Hopkins hospitals. They really liked the work we did with them in patient satisfaction, and so they invited us to, they engaged us for more work at a larger hospital at Bayview, and we're succeeding there. The market is enormous, $800 billion every year that is wasted in healthcare. To just touch the tip of the iceberg, in fact, CMS is withholding 1% every year from Medicare charges. What they're doing is they're pooling it and redistributing it based on success. So we have patient satisfaction tests that help physicians do the right thing. That 1% is growing to 2% over the next 5 years, so that's over $1.5 billion opportunity of dollars, again, redistributed to those successful hospitals. We also have available right now and being used risk reduction tests online that the physicians can take to help them understand, again, what are the right behaviors to succeed. So in terms of competition, we're targeting the hospital-based physicians, those who touch the most patients in the hospital. We have a best practices rules engine. Our current customers are hospitals, physician groups. We're growing to these others. We have a strong team. And we're looking forward to growing in the next 5 years to a $33 million company. Thank you for your time and attention.